Hello, everyone, and welcome to ConfiTalk series. My name is Dr. Neda, a general practitioner in Toronto, and I am instructor at ConfiDentist since 2014. I'm very thrilled to be here today to discuss important and critical topic of pain for your ACJ exam. First of all, we need to know the source of pain, because when we talk about pain during this exam, the pain presents a wide spectrum of challenges, from diagnosis to selecting proper tests and also selecting the proper management, the most conservative management, yet effective. I review different types of pain, the source that we may have in the exam. It may be musculoskeletal, it may be soft tissue related to pathologic oral lesions, it may be related to pulp or periodontium, and also neuropathic pains. By the end, hopefully, you have an idea how to approach the questions in your exam and how to answer them with confidence and tackle them effectively. Look at what different types of pain we may have in your exam. Some types of pains are presented as acute pain, which they are actually occur suddenly with limited duration. A good example of this one is irreversible pulpitis, dental abscess, or the pain that happens after extraction of a tooth. The other type of pain that we have in the exam are chronic pains, which lasts longer than acute pain and usually associated with a long-term illness and suffering. A good example of chronic pain is trigeminal neuralgia or temporomandibular disorders and painful TMJ. Another important matter for pain in the exam is actually intensity of pain. Is it mild, moderate, or severe? Why it's important? Because the management is different for any type of these pains. Anytime that we want to prescribe medication for patients as analgesic, systemic analgesic, we need to know the intensity of the pain. Frequency of pain is very helpful for diagnosis of the pain. Is it occasional, intermittent, frequent, or constant pain? Also, the quality of the pain. Is it sharp, dull, throbbing, burning? It's important again for diagnosis and management. Let's start with some examples and some questions. This case is a 25-year-old female with acute onset painful mouth accompanied by fever and malaise. Duration history is 2 days ago. The patient also gives a history of cold sore that occurs several times per year on her lip. What is the most likely diagnosis of this condition? In this condition, we have image as well. This image shows an ulcer in the buccal, over the buccal mucosa, and please have a look at vermilion of the lip. We have redness and bleeding. So this image clarifies that the condition is not just in one side. It's multifocal and widespread. The other important note about this case is actually having systemic involvement, fever and malaise. The acute feature of the disease is something that mentions in the history of patients. Cold sore is something that for this patient happens several times during the year. Herpes labialis is something that happens for this patient. All of these information are sufficient to help us for diagnosis. Diagnosis of this case is erythema multiforme. When we talk about pain, about pathologic lesion, which are accompanied with pathologic lesion, these pain can be often involve inflammatory process accompanied by infection with neoplasm or immune responses. Here we have acute inflammatory condition, which is erythema multiforme, and it's painful. Management of this condition requires medication, which is topical corticosteroid as first choice. And also, patient has fever, so antipyretic is another medication that we consider for the management of this condition. Look at the other case that we have, another example that you may face in your judgment exam. Patient is 32-year-old female, complain of pain in upper left back tooth. Pain is spontaneous and throbbing since 2 days ago. Tooth 2-6 has lingering response to cold and sensitive to percussion. We have this information about the situation plus this x-ray. Now we need to diagnose the condition. The source of pain is a tooth. Now, what do we have? We have spontaneous throbbing pain as quality of the pain. Duration is 2 days. And the other thing is lingering response to cold. When we have lingering response to cold, it means we have inflammation inside the pulp, which is not reversible. This condition is symptomatic irreversible pulpitis. Can we add more choices to be selected? Yes, because patient has pain on percussion, which means the inflammation already reached to the PDL area and causes some pain. So the other option that we can actually select is symptomatic apical periodontitis. Now, what is the best management of this case? Root canal treatment is management to help the patient get rid of the pain. Management of this case, of this patient, is not medication. Please look at other scenario. Patient is 49-year-old male with pain on chewing in lower back teeth since 1 month ago. Pain has been getting progressively worse recently, and he avoids chewing on the right side. Extra information. Tooth number 4-6 does not respond to cold. Duration of the pain is 1 month, and the chief complaint is during the chewing. There is nothing about pain to hot and cold, but we have a result of intraoral test which shows there is no response to cold. In the X-ray, we have rarefying osteitis or lucency, which shows the extension of the inflammation to the preapical area. As we don't have any response to cold by this tooth, the situation of the pulp is necrotic pulp. So the answer is necrotic pulp. Can we select more option? Yes, because patient has pain on chewing and avoid using the right side during the function. Symptomatic apical periodontitis is another option and diagnosis that we select for the exam. Actually, this question has two correct answers. If anyone P can select just one answer, they can get half of the mark, not the whole mark. The whole score requires to select both correct options. This is another case that you may have in your exam. Patient is 28-year-old male with painful gums and bad breath. This is chief complaint of patient. Duration 10 days ago, since 10 days ago. He started smoking 3 months ago, 1 pack a day after he lost his job. And this is what we have as intraoral image of this patient. What do we have as information for diagnosis for this case? Painful gum, bad breath. Okay, patient has lost his job and also heavy smoker since 3 months ago. We have a stress, we have smoking at the same time. In the image, something that we have is gingival papilla with reduced height, necrotic part, punched out papilla, pain, and something that patient says bad breath. This is a case of necrotizing gingivitis. Necrotizing gingivitis is actually a bacterial infection which is promoted by some predisposing factors. For this case, the predisposing factors are smoking and stress. What is the management of this case? Debridement, topical antimicrobial, systemic analgesic, and also we need to control the predisposing factor. Sometimes necrotizing gingivitis is associated with systemic involvement, like fever. In that case, systemic antibiotic will be added to the management of the situation. This is another example. A 20-year-old male presented with continuous pain on left side face for the past 3 days. Pain has been getting worse progressively and swelling developed yesterday. So we have combination of severe continuous pain and also swelling. Tooth 2-5 with disto-occlusal composite restoration and preapical lucency does not respond to cold. These are actually the information that is provided for diagnosis of this case. 2-5 doesn't respond to cold, so the pulp is necrotic. Something that we can select between the options. Plus, there is history of severe pain and swelling after that. This is a presentation of development acute apical abscess. in this situation, we mark two correct options, which is necrotic pulp and acute abscess. This is a situation that pain, the source of the pain is infection. The image shows buccal abscess, which can be developed because of necrotic pulp in upper and lower premolars and also upper molars. The initial management of this case is incision and drainage, and then after the swelling subside, we can move forward with proper treatment, which might be root canal treatment or extraction, if for any case that the tooth is not restorable. This question shows tooth 2-5 with disto-occlusal composite restoration, which means we have enough tooth structure. So we can save the tooth by root canal and proper restorative approach after subsiding the swelling. If this patient has some systemic involvement like fever, malaise, lymphadenopathy, then we need to add antibiotic between the options of management. Another case. This patient is a 48-year-old female presented with complaint of frequent pain from left side that began 6 weeks ago. She described it as being episodic and sharp stabbing pain, which lasts for few seconds, and she notices it more when she washes her face or puts on makeup and also by brushing her teeth with cold water. Okay, how we can diagnose this case? The only time that patient has this pain is by touching the face, washing the face, and also during the makeup or by brushing. It means we stimulate something in that area that causes pain. This is an example of a neuropathic condition, which is trigeminal neuralgia. The reason that patient has pain is patient stimulates trigger zone, and then the pain occurs. What is the duration of the pain? Very short, just for a few seconds. But the quality of the pain is sharp and stabbing, severe pain. What is the management? Management of trigeminal neuralgia needs medication, which is carbamazepine. So in the exam, you may have these options actually to select the proper and correct one as diagnosis. Trigeminal neuralgia is the proper one. Maybe you have the following question as the management of trigeminal neuralgia, which I told you it's carbamazepine. Another case with pain. Patient is 21-year-old male, complain of mild aching pain, gradually increasing swelling in lower right face since 1 year ago. Pain worsens with chewing. Left side TMJ is clicking at opening and closing, and patient reported occasional morning headache. So the intensity of the pain is mild And also the quality of the pain is aching. It is not sharp. Also, it's chronic pain. Look at the duration, the history. Started 1 year ago, since 1 year ago. In the image, we see asymmetry. One side is a little bit larger than the other side of the face. Patient has more pain during function of chewing. And we have also clicking during the opening and closing. All of the findings that we have here for this case guide us toward musculoskeletal disorder pain, TMJ problem. So the best actually option that we can select for diagnosis is TMJ disorder. And what is the management of that? The management of this case, the best available management is to start with occlusal splint. These are the available options that you may face in the exam to choose your diagnosis. Temporomandibular disorder or myofascial pain disorder, which is manageable by occlusal splint and also follow-up.